Good evening. My name is Chris Martin. I'm with the Illinois Podiatric Medical Association, and welcome to this month's version of Feet Forward, our monthly program for CAN TV viewers about foot care topics. And tonight we're going to be talking about kids' feet health, and we have with us Dr. Misty McNeil, who is a podiatrist from Elmhurst, correct?
Yes, thank you for having me.
Hey, anytime. I should tell you that this will be the first of two CAN TV Feet Forward episodes on kids. We're going to do a back to school episode next month. So if you've got some kids, especially elementary age school kids that are going back to school, and you have questions about buying the right shoe and that kind of stuff, which is very common, especially in August, you'll want to tune in next month, and we'll be promoting that a little bit to you guys then. Dr. McNeil is a podiatrist at Elmhurst, as I mentioned. She went to Scholl Medical College and got her degree in podiatry there. Did her residency at Loyola. And as I understand it now, about half of your practice is kids right now, right? And that's rather unique, isn't it?
It is pretty unique. Actually, most people think of podiatrists as only treating adults. And now many podiatrists are treating from 0 to 100. And in my practice, I've been lucky, probably because I am a mom and I have 2 boys of my own, to be able to generate that sort of a practice and have a lot of kids every day on my schedule.
And how rare is it for a podiatrist to focus that much of his or her practice just on kids?
I think most podiatrists see a little bit of everything, and it is rare. I don't want to say it's extremely rare, but you'll probably find maybe one in every 10 podiatrists maybe sees that many kids. That would be a good estimate.
That's a good segue into our topic tonight. The American Podiatric Medical Association did a survey of about 620 parents earlier this spring, and some of the results they found were a little surprising to me, and maybe to our viewers too. They found that only 25% of parents have taken their children to a podiatrist for treatment of any kind of foot ailments. Now, were you surprised when you saw those results?
No, because most of the parents that we get bringing children in are bringing them in after they've complained for quite some time. It's not typically an acute situation. It's more of a chronic or long-standing problem, and that's what brings them in. And most parents say, I wish I would have brought them in sooner. Why
do you think this has gotten, that percentages could and should be a little bit higher, right? We should be educating parents more about the importance of bringing kids in at the soonest time when they suspect something's wrong. We often do that with parents about medical conditions, for instance. Most pediatricians would urge parents to be overcautious. It's better to call and bring them in than to, wait and put things off. Wouldn't you agree?
Yes, that is definitely true. And I think one of the things that keeps people from bringing their children in is just a busy lifestyle. I'm a mom too. I have a full-time job and a full-time practice that I run, and running the kids to soccer practice, to school, preschools, it all becomes very laborious. And oftentimes if a child only complains maybe once a day or only with certain activities, we just kind of brush it aside, and I'm just as much a victim of it as I'm sure every mother or father is. And so what we'd like to see is the sooner people come in for treatment, the faster we can get their kids better. And that is very important to know, because as a mother, no one wants to see their children in pain.
And there are some consequences, some negative consequences for parents that maybe put things off. One of the things the survey found was 49% of the parents surveyed would take their child to a podiatrist's office for something like ingrown toenails, which the survey points out can lead to a significant problem if it's left untreated. So what our message is to parents out there that have little kids is if you have a question, to call a podiatrist. But that leads to the other problem that we were talking about earlier, which is if the parents are not getting the information from the pediatrician about what podiatrists can do, they don't know to call. So you've got some tips for parents who, when they go to a pediatrician's office, they have specific questions that they can ask the pediatrician while they're doing an exam that can help even the pediatrician, who often is busy too, and needs some guidance as well. So why don't you talk a little bit about how parents can interact with a pediatrician so that the parents and the pediatrician together can team up with a podiatrist and get a good outcome for the kid.
Right, that is an excellent point. And one of the main things is that you go to your doctor prepared. You have a short visit whenever you're with any doctor, and especially your pediatrician. Exam, and it should be a full head-to-toe exam, just as the pediatrician looks in the ears and checks all other aspects of the child. They should be looking at the feet. And one of the things that's really important to do is that parents ask while the pediatrician is sort of working their way down to the feet. And one of the things that's always done in any child under 2 is checking of hip stability. So you sort of see your pediatrician moving the hips in and out, moving the legs around, and that's a great time to say, hey, how do his feet look? How do her feet look? Is there any signs of their toes going in, or any problems that with their nails, or any signs of any lesions, warts? Warts are seen in children as young as a year. So it's an important thing that someone takes a good overlook of their feet. And also for parents to be aware, parents need to really look at their child's feet, and if they notice anything they're concerned about, to get them in with their pediatrician or a podiatrist.
So even, for instance, at that first well baby checkup, the baby is born in July, for instance, and the parent will take the child to the pediatrician a couple months afterwards for a typical checkup. What kinds of things, even at that age, can a podiatrist do in terms of an intervention or a screening of some kind?
Right. Well, actually, as early as in the first few days after birth, the child's feet should be checked. At most births, they are checked immediately for any signs of clubfoot, which is a very obvious deformity of the foot where they turn in and turn up towards the legs. However, another more subtle deformity is called metatarsus adductus, and I'm just going to quick see if we have a little picture here we might be able to put up. Let's use that one. That's probably our best view. So the long bones there sort of leading out to the toes.
That's right here?
Yeah, exactly. Right in those areas. Those bones start to sort of turn in, or where you'll see both feet in toeing, and you get a C-shaped curvature to the outside of the foot. And
so it goes like this?
Well, it's hard to see on this view, but it would actually, let's use this one as an example of the C-shaped curvature. Okay. And it actually curve towards the big toe.
Oh, I see.
Right, exactly, that way. And that can be a very, very subtle finding, and that's very important to look for yourself as well as have your pediatrician check them for, because that is something that can be treated right away. We typically treat that with casting, sometimes right in the labor and delivery area, sometimes as early as the 1st or 2nd day of life.
Is that right?
Yep.
Wow. And as a parent myself, I know that sometimes when things are treated very early, they're less painful or onerous to the child, because they heal so quickly and they're growing so quickly. So sometimes getting things done earlier is better than waiting.
And that's definitely the truth with all things that happen that we see at birth, all of the deformities we see at birth with children. The castings that are done are much more effective in those first few days, first few weeks of life than they are when, say, the child is 8 or 9 months.
Now, what about the next sort of touch point, walking? What